hindered everything that I did. I was unable to do so many things. But now, at age 56, I'm restarting my life without the pain. And for that, I am completely grateful. My hip replacement journey started about a year ago when I was doing my daily walks. I usually walk 3 miles a day, and I was feeling sharp pain in my right leg, specifically in the upper hip thigh area. And I thought I had just pulled a muscle or something. So I just kept walking, and I walked for the next couple of weeks and then months, but it started getting worse. And then I started limping. And then the pain was just so unbearable that it would wake me up at all hours of the night. I decided to call MedStar Georgetown University Hospital Orthopedics to make an appointment, and an x-ray was administered of the area, which showed severe arthritis. But not only that, I was missing the cartilage between the acetabulum and the femoral head. So the bones were rubbing against each other like this, which is why I was in excruciating pain.
Hip replacement's an excellent surgery. It's something that's been around for probably 50 or 60 years. There have been dramatic improvements in the durability and effectiveness of the procedure though. And so it now can be recommended for patients who are even quite young because of the durability of the devices that we're using.
The surgery itself lasted about 2 hours, and it was a complete success. And even at the recovery room, when I woke up fully, I already felt no pain, only the post-surgery and anesthesia pain. But that was instant, not feeling that pain that was just so awful for the past year. And the miracle of the day of surgery was that in late afternoon, I was able to walk from the hospital bed to the hospital room bathroom with the aid of a walker and a nurse. And that was just in itself amazing. Post-surgery, I was in the hospital for one night and went home the next day. And Dr. Evans' team told me to walk around my home, that would be my physical therapy. And I took videos of me walking a month after surgery, 2 months after surgery, and that really motivated me to do better. Every day I felt the legs getting stronger, the hip getting stronger and better.
Your gait looks great. Stride length's really nice and even. Shoulders are nice and even. No, it all looks good.
After the surgery, my life has completely changed, and 6 months down the road now, I have made so much progress, and I'm so grateful to the MedStar Georgetown University Hospital Orthopaedics team for really giving me my life back once again.